Hi, my name is Louisa from Aristocrat Plastic Surgery. Today we're going to be talking about Ultherapy and Xeomin. Um, and specifically, we're going to be really focusing on brow lift and non-surgical brow lift. So this is Dr. Kashan. He's part of the practice, and he's going to be joining me today. So Ultherapy is been around for quite a number of years now. It's a ultrasound that helps to tighten the skin, and it uses energy in specific depths, and we're going to talk about it to help lift and tighten the skin. And Xeomin is a neurotoxin or a Botox that helps to also gives that extra lift, which Dr. Kashan will be talking about in a few minutes. So Ultherapy helps to build collagen in the skin by using focused energy to help uses these microscopic little pieces of energy into the skin, so it actually forces your body to build some collagen. So collagen actually is what gives us our youthfulness, helps tone our skin, helps firm our skin. And as we age, collagen breaks down over time, so we lose the strength and the elasticity in our skin, which leads to the visible signs of aging. And you can see on the bottom of the structure, as we're young, the structures are much tighter, which gives us a much smoother look. And as we get older, that tightness kind of seems to loosen, and we get looser skin, and we get jowling and more wrinkles. So here's signs of aging skin. Dr. Kashan can tell us how our skin ages over time.
Sure. So this is actually a great schematic. If you take a look from left to right, left being that younger appearance, you can see her brows are in a great position. They're a little bit higher up above the bone over here. You can see this very little wrinkling, even around the mouth as well. You don't really see as many folds. And as you move kind of over to the image on the right, you can really see the difference. You can start developing those wrinkles on your forehead, in between your eyes. Even the eyelids themselves, they look like they have excess skin on them. They're a little bit lower on the face. You start getting a little bit of what we call that tear trough deformity as well. And just overall, what you can notice is that the fat that was up here in the cheek region, or what we call the malar region, has slowly descended over time. And you can really see the same thing in the neck as well, where before on the left, it's very smooth. You can see the perfect contour, and now you can see what we call those loose skin and a little bit of platysma banding going on.
So Ultherapy helps lift the skin by building collagen. It's the first FDA cleared to help lift the skin around the neck, the chin, and the brows, and it helps to improve the appearance of fine lines on the décolleté. The décolleté is a big area for a lot of people. A lot of people are side sleepers, and when they sleep on their side, they crinkle their chest, and they get a lot of little fine lines on their décolleté area. Ultherapy is one of the few treatments that helps soften those lines. So Ultherapy has been around for quite a number of years. It uses some ultrasound technology, and the treatment is customized. So we can actually scan the face, and we can see what depth we're going to and what we want to treat. We don't want to treat too far. We don't want to hit the bone. We want to kind of go above it. And I'm going to show you a scan later of what we are looking at under the skin and what we are treating and why we are treating it. So the treatment is a customizable treatment. We have, if done correctly, we have a 95% patient satisfaction rate after following 1 year after the treatment. So this is one way to help tighten skin without surgery when you combine certain lasers and Ultherapy. Here you go. You'll see what we can see under the skin. So we do the scan, uh, and the ultrasound is very safe. It's done during pregnancy, and just to see, to visualize how everything is under the skin, where we're targeting. So we're looking at the areas that we want to map, and there's different transducers that we put onto the handpiece that go deeper or more superficial, depending on what we want to target. So we want to pinpoint the collagen-rich layers. And once you hit those layers, it actually helps to build more collagen by treating the collagen. So now I'm going to show you, once we get to the Ultherapy machine, you'll see, but you can actually see where the SMAS is, the subcutaneous tissue, and all the white little areas, the little white dots, is the collagen-rich fibers, and that's what we want to treat. Good. How does Ultherapy work? So there's many different modalities that we have, and um, in plastic surgery, in the office, the first being is a facelift. A facelift is really great for people who are older. They have extra skin that they want to tighten. Don't you agree?
Yeah, exactly. I think it's for someone that may, even if you try to use something else, they really just ultimately need to remove that excess skin, and it's not going to snap back just with conservative types of treatment. But I mean, to go into what Louisa was talking about, if you have some laxity but not a ton of excess skin, well, therapy really is an amazing option. I mean, I've even had it done on myself as well, and I really wanted some more contour around my jawline because I noticed over the years it just got a little bit lax there, and it really almost, I like to think of it as it almost like shrink wraps your skin around you to really give you more depth throughout your neckline, face, and even upper forehead, brow region.
We also have to discuss that a surgical facelift doesn't, although it does pull back the skin, it doesn't treat the actual skin that's left. So if you have paper thin skin after plastic surgery, after a facelift, you'll still have paper thin skin, correct?
Exactly. It doesn't change the quality of the skin.
So we want to think about changing the quality. We want to make sure that we always have thicker skin, more collagen-rich skin, more elasticity in our skin. So some of the other modalities like lasers, radio frequency, they go through different depths, and each of those modalities work to target something different. But when you look at on the screen, you look at how deep the ultrasound goes. It actually goes just as deep as a surgical facelift without the surgery. It just helps to target those areas, and it helps to like just lift everything up. So as we said earlier, we have different hand pieces or not hand pieces, transducers that go into the hand piece to target the different depths of the skin. So we scan the face, and everyone's different, so it's not just a stamp for everybody. We scan the whole face, and we see where you need more collagen, what transducers we would need for your specific skin and for areas. So the neck would be different than the mid-face, the brow would be different than the décolleté. So they're all different. So we scan. So this gives us an ability to scan the body, the areas that we want to treat, and put a customized treatment plan together for each individual. So now you'll actually see a difference. It takes about 3 months to see the complete difference, 3 to 6 months. But it takes some time, so it's not like a one and done. It's not like you come in and you get filler and you see immediate results. This is completely different. It's you do the treatment, you'll have a little bit of swelling at the end, but not really noticeable. But you'll see an immediate improvement. But then over time, it just gets tighter and tighter. So if you look at the woman on the top, you'll see some early laxity. So that's a young person who has very little bit of looseness, but you'll see the difference in how much improvement that you get with each type of patient. And as you get older, you're going to need a little bit more tightening. So when you're older and you have more skin capacity, you're not going to get as tight as somebody who is in their 30s when they do the treatment. Don't you agree?
Yeah, exactly. And I think that that bottom picture really kind of shows it best. You can see she did definitely got much better contour, specifically at her neckline over here, as well as her jawline, but she probably would benefit from maybe a couple treatments ultimately and a combination of tailor-made treatments to her skin quality.
Yeah. Which is what he says, tailor-made. So everything that we do here is tailored to the person. So if the person who on the lower half of the screen would come in, we will probably suggest a combination of treatments, not just Ultherapy, wouldn't you?
Yeah, I agree. I think that's exactly the thing. You know, like Louisa said, it's not just one stamp fits every type of patient. You have to do what we'll always offer you what we think will get you the absolute best result, and over however many treatments to get you there.
Okay, so we treat different parts of the face. So we could do a brow lift, a submental area. We do the décolleté, and so as we were saying, we just customize the treatment for the person.
And here you can actually see, this is the before and after brow lift. It really gives you a more youthful appearance in the sense that you can see it a lot more, let's say in that top left picture, but the before and after, you can see she has much more upper eyelid show. So you don't look as tired. It gives you an overall younger look. It brings your brow essentially back to where it wanted to be 10, 15 years prior, which really, really does affect the dynamic of the face overall.
Okay.
And then this is kind of what we had mentioned before too. You can see the angle from the chin to the neckline before and after. It's much deeper, which is a good thing. You want to see that the skin has shrink wrapped around that neck, giving you a much better contour of the jawline. Definitely, if you look in that bottom left picture, you can see it was really that skin laxity was her main issue, even though it looked like she may have had some fat under there. Just with the Ultherapy treatment, she looks much thinner and much more improved, proving that sometimes it looks like it's fat, although it really sometimes is just some skin that needs to be treated.
We also have to keep in mind that when you have a lot of excess fat, this may not be the best option for you, but this is a good non-surgical treatment that helps tighten the skin around it. And if you're looking for something non-surgical, this is a perfect adjunct to a treatment. Oops.
Louisa,
Yeah, we can also do the décolleté as we mentioned.
is it does it also work for Marionette lines? Marionette lines.
So the Marionette lines, can you see me?
Yes, yes.
No. So the Marionette line, when you lift the face, the Marionette line, I think, are the most difficult areas to get to. So it does lift a little bit, but sometimes you need a little bit of volume there. But you may need something else.
Yeah, I agree. I think this is where combination treatments really work well. Sometimes you can use filler at the same time, whether it be a hyaluronic acid, whether it's fat injections, and the combination is what is the most important part. Sometimes it's a skin tightening and that might be needed, plus almost like think of it like a skin plumping type procedure too, to fill in that deficit that's developed over time.
Okay. So the treatment, so we give you a little bit of the Tylenol for the treatment. Some people, we need something a little stronger for the treatment. We generally like to give our patients a combination of, it's a cocktail that we like. It's like a Percocet and a Valium. Or sometimes we give them like an MKO. That's midazoline, ketamine, and what?
And Oxy.
Oxy, okay. So it helps to, so it's something to help you relax, and something for the pain, and something for the anxiety, so that you don't feel it as much. So most of the area is not painful. I think that the jawbone, closer to the bone, is where you have a little bit more of heat. You'll feel more heat than anything. Um, but the rest of it is not as bad. It's really not as bad. And we try and go to it as quickly as possible, and try and kind of move it around, so you're not feeling that constant heat in that one spot. Good. So what you expect during the treatment, we do a medical consent form, and we clean the areas, and we do some before and after pictures, and then we discuss the areas that really, really bother you, so that we can customize the treatment for you. I mark the area, and then in my own head, I kind of calculate the lines for you, even though there's already a basic there, we kind of tailor it for you. So we would then to deliver the energy in the areas that we need. So after the treatment, what do you expect? So right after the treatment, you're going to feel a little bit of soreness. I would say day 2, but it almost feels like you have a bruise. But when you look at your face, you don't see anything. You may have a little bit of redness for an hour or so, but otherwise you can go back to your normal activity without having any side effects at all. We will tell you though, if somebody is on a lot of blood thinners, you may get a bruise because of that heat that's going in the dermis area. So you may get a little bruise, but for the most part, you won't see anything. You can go right back to your regular activity. Okay, and we do a follow up about 90 days later to see the progress.
So potential side effects, and just to go over again, like I had this done, and honestly, I had nothing afterwards. No one knew I even had it done in terms of immediately after the procedure. You couldn't tell looking at me that there was anything done to my face, and I absolutely love the results. But we have had people, and everyone's very different. People have said that they noticed a little, almost like rawness of the skin. So they'll see it appears a little red, a little flushed. That usually goes away on the same day. You know, if I had it, I don't remember having it because it was gone by the time I had left the office. And then the swelling that you actually experience, I did have a little bit of swelling, but not in the sense that you could tell I was swollen. It actually just looked like my skin was much tighter afterwards, and it actually looked good. I actually kind of liked the way I looked immediately after the procedure. It's not like another procedure where you would actually see this large amount of swelling. We're talking about minimum amount. It just makes you look a little fuller, and then it goes away within 1 to 2 days. In terms of one thing that we haven't really mentioned is, and really what is great about it is there are no scars associated with this. There's no cuts made on the skin. This is all done transcutaneous. There's nothing that will happen from the machine itself, which really is the most beneficial part of it in my mind, is that it's really, if you don't want any type of scar, this is a way to get a scarless lift, and really the best way to do that. And then, like Louisa said, once in a while you can get a little bruising here and there, and you can feel a little pain for a day or so, but it really is very, very minimal. I would say a 1 out of 10. And then, you know, by day 2, day 3, you don't even feel anything anymore, and you wouldn't even remember that you had it done. So it really is amazing.
I also want to talk about how long the treatments last. So when you're doing it, and when you're younger, when you're doing it, when you have more collagen, when you break up collagen, it actually makes more collagen. Whereas if you're older, you need to break more collagen to divide and make more. So when you're older, not that it doesn't last as long, you may need to do an additional treatment. But generally it lasts about 2 years. I like to say 2 years. But if you're like I did my mom, and at the time she was in her late 60s, I'm sorry. And I felt like we needed to do a booster like in 6 months, but I did it 3 times already over the course of 10 years. The first time I did it, I think I did it, and it lasted probably about 3 years. And then the second time I did it, I just did my brows. So I think it lasts a lot longer when you're doing it when you don't have as much laxity. I feel like the more laxity somebody has, you may need to do them a little closer apart, closer together, or just do a booster in about 6 months. So we don't have to, there's nothing that you have to prepare for when you come in for oral therapy. There's no pre or post treatment required. But I do recommend always to put sunscreen on and to use a retinol on a regular basis to help maintain the results. And you'll actually notice the difference in about 90 to 180 days.
And
Sorry.
I was going to say, before we move on to Xeomin, I just want to circle back to something Louisa said, which I think is really important. You know, the thing when it comes to skincare and skin tightening and lotions and all of those kinds of things, I'm not talking about all types of skincare, is you want to stay ahead of aging. You don't want to have to play catch up. And that's to her point, where when you have that skin that's rich with collagen and can react the best to whatever you're doing to it, that's the best way to prevent wrinkling and aging and everything like that. Don't wait until you start noticing major changes to try and now combat it. I think that's the best way to stay ahead of it.
Absolutely, absolutely.
We also got several questions about Ultherapy, so maybe you can answer them now.
Some questions, absolutely.
So if you use this treatment, how is it effective when you have dental work done?
So the question is, when you're getting this treatment, how effective?
No, like how is it going to be effective when you get some dental work done? Is it?
I mean, if you're getting some dental work where you have an active infection, obviously I wouldn't do the treatment. I'd like for your body to heal, because any of the treatments that we do in this office, we're causing a micro wound, so it's forcing your body to use its immune system to help build up and to help heal. So if your body is really in pain, or if you have some issues going on in your mouth or anywhere else in the body, I'd wait for that to bump. Do you agree with me?
Yeah, exactly. I agree 100%.
I think also you won't be able to, I think you'll feel the pain more also if you're going through some dental work. So I'd wait until after it's done personally. Yeah.
And if the question is also, you know, can you get it done if you've had dental work? You 100% can. That's not a problem. It's just we don't want you to have that active dental work happening. If it's something that happened 6 months before, let's say you had a cavity filled or something, that's perfectly fine. It's safe with the Ultherapy.
Can I use Ultherapy to have a more defined jawline?
Absolutely, you can, and that's exactly what it's for. It's to help define the jawline. It helps to tighten that skin around it. And we actually, when we do the scan, we actually see where the bone is. So we try and treat around it so that we do get that tightening.
How much does it cost? Lots of people ask about the pricing.
So each area is broken down into separate categories. So I would say for the brows, if you just want to do the brow lift, we charge $1,100, and we treat the brows and the under eyes with that. The mid face is really just the cheeks and the submental area. Can they see me? No? Can they see me?
No.
Oh, the cheeks and the submental area, and that is $3,000. And then the full face is $4,500. We can also do the lips. The lips itself is $450. If we're doing the décolleté, is $2,500. And if we're just doing the submental area, which I wouldn't recommend just doing the submental area alone, because the muscles from the submental area and the cheeks are kind of attached. So you want to do that together. So if I do a submental area, it would just be for a touch-up.
Is it a one-time treatment?
It usually is a one-time treatment. As I said with my mother when I did her, um, I think I should have done a booster shot on her and do it 6 months later. So yes, it is.
Okay. So,
Does it help with
Perioral
yeah,
veins.
veins?
Yeah, veins, I think I said, right?
Um,
Sorry, we're gonna check that. We just got another question. Just give us 1 second.
mm, does it help with? Oh, preorbital veins. No, it doesn't. Um, it doesn't help with the preorbital veins, but it does help with the fine lines around the eyes, but not the veins. How long after pregnancy can you do it? I would get a clearance from the doctor, but I would imagine if you're breastfeeding, right? Can you do it for your breastfeeding?
In general, we try to say for anything like that, it's probably safe, but we always like to make sure that you don't have anything else physiologically going on, and breastfeeding is pretty taxing on the body in itself. So in general, we want to just make sure to hold off on stuff like that.
So if you had a Morpheus 8 treatment, how long should I wait until receiving Ultherapy? So the Morpheus 8 treatment is a radiofrequency microneedling device that actually dissolves fats. So I would wait about 3 months to see if you actually needed the treatment, because you're gonna get some, some of the fat will dissolve, and you're also gonna get some tightening with the Morpheus. The only thing with the Morpheus 8, you really don't do the cheek area. So you may need some tightening in that area more than the submental area in 3 months, but I would wait about 3 months.
And then there's a question about nano fat injections, and what I would say is very similar to how soon can you use Ultherapy after nano fat injections, and that's any fat grafting to the face. And I think you want to wait, the same thing that Louisa was saying, wait 3-4 months. You want to see what part of the fat survives and how it takes and how everything looks before you try doing anything else. You want to let things settle in. You're going to be swollen, and then once everything kind of settles in, she'll be able to tailor the Ultherapy treatment to you, as opposed to kind of guessing what it's going to look like after the swelling goes down.
Yeah, I also like to see, I'd like to do the Ultherapy before a fat injection, because you're going to get some tightening already, and you want to see how much tightening you get, and it'll help the surgeon to see how much fat you need for that.
Exactly.
Yeah.
how about, is the jawline considered?
Is the jawline considered its own area or part of the lower face? It's considered part of the mid face. Yes.
And then I think there was one question about Xeomin. Let's see where that went. Is Xeomin included in the? No. So if the question is it part of the treatment for Ultherapy? We do them as separate.
But we have a
entities.
special.
Exactly, but we do have a special currently that's combining the two, and I'm going to kind of dive into the whole Xeomin talk in a second, if there aren't any other questions.
Does the brow lift include the under eye area too? Yes, we do the under eye area. So for the brows, we do the upper brow, the crow's feet, and underneath. So you get the full upper face for that treatment. Does a full face create? Does a full face create more face contouring after all? Yes, it does. But like you said earlier, it's customized. So when you come in, we'll see where you need a little bit more contouring and more tightening. So let's just keep in mind that Ultherapy does not give you volume. So it's not going to give you volume where you have loss of volume. This just helps tighten the skin, and it helps with crepiness. Some people need more volume. So can you talk about that?
Yeah, exactly. And I think this applies to any facial rejuvenation procedures that we do, whether it be Ultherapy, whether it be a facelift, regardless of the skin tightening and the deeper tightening. Like Louisa said, some people just
require fat or fillers or whatever adjunct you want to use to try and help fill those areas. It'll look much smoother, which is great, and it'll make the filling part look much better. For example, so if the skin looks better and then we fill, it will give you a better result overall, as opposed to trying to fill something that's not as taut. We would have to use a lot more filler or fat to get that similar type of response. And I think
that's it.
I think that's it.
All right, so he's gonna go over the
Xeomin.
Sure.
Mhm.
So Xeomin, so this is a botulinum toxin that we use, and whenever we're talking about botulinum toxins, specifically to the forehead, eyebrows, and between the eyebrows, the main thing to keep in mind is that this is meant for paralysis of muscle. So this is meant for deeper wrinkles that you notice when you're making different facial expressions. For example, when you're frowning, when you're raising your brow, and things along those, or smiling, for example. Let's move forward. Sorry. You know, and this is really where Xeomin is so versatile. For one, it's an excellent thing to use with Ultherapy because they work synergistically, right? You want to tighten that skin, and you also want to address the muscle, and this has to do with that whole filler phenomenon too, where don't just look at it as one or the other. Look at it, how can I get the best result with a combination of things to really get you to the look you're looking for? And if you look at this picture, we really could use it for so many different things, whether it be forehead lines, those angry lines or 11s between your eyebrows. Use it as a brow lift is absolutely amazing. When you smile, so you get those crow's feet around your eyes, is an excellent source of it. And then kind of a little bit more less commonly, because you don't see it as often, but for people that tend to have what we call gummy smiles, when they smile and you see a lot of their upper gums, you can actually inject Botox in the right area. Will bring that lip down and really give you an aesthetically pleasing smile. And then once in a while, we use it also in the chin area if you have a hyperdynamic mentalis muscle over there as well.
Ok, estos juntos, esto separado, esto separado, esto separado. Esto, usted mira, esto todo similar. Es uno.
Is someone asking a question, or is maybe not? Okay. So moving forward, what makes it unique, and this is really, oh, sorry. One second. This is really the what I think makes Xeomin best. I'm sorry, we're having issues. Is that it really doesn't have any excess protein put into it. So, and you can really tell the difference in the unlike the other botulinum toxins, this doesn't need to be refrigerated because it doesn't really have those preservatives. And the concept really is the less preservatives you put in your body, the less likely your body is going to try and break down the product because it sees it as a foreign object as opposed to seeing it as a natural object. And the theoretical advantage is that it will last longer than the other ones as a result of that. And you know, we definitely have had patients that have used other forms of botulinum toxin that were really just not getting responses anymore for whatever reason. They had been using it for years, and they transitioned over to Xeomin and the same amount of units, and they had the same better results than they had with the other version. So I think this is where that tailoring also comes in handy. You have to use what works best for you, and a lot of people have transitioned over because they felt that that worked the best for them and also lasted the longest for them. And then finally, which again, this applies to that whole protein thing I was mentioning, is that you're less likely to get any type of reaction as a result of it, because again, there's less for your body to address or acknowledge as a foreign material. So again, next slide. All right, well, you know, we wanted to thank you guys for joining us, and thank you for asking questions. We're going to show you our lovely model. I'm going to show you how we mark into
questions about Xeomin?
Yep. And then let's see. Does anyone have any questions about Xeomin specifically?
I got one. Can Xeomin be used for the masseter muscles?
Yeah. So Xeomin's a great option for masseter Botox, and really, for those of you that don't, it's right on your jawline, and it really has multiple advantages. One, it will slim your face over time. So it'll give you a more defined jawline, because if you have a little bulkiness of that muscle there, over time it shrinks and it really allows you to see that jawline beautifully. The other thing it works really well for that same injection is if you grind your teeth at night, if you really clench, you know, a lot of people, that's historically what we've used it for, and it gets rid of that pain you have when you grind your teeth at night. And people have told us that they also don't feel the headaches that they wake up with that are teeth grinders.
Dr. Kashan, can you talk about how often you need to do the treatment?
That's a great question. So everyone's different. In general, I like to tell everyone, the more often you come in, or the sooner you come in, the better we'll be able to control your results. Now, that could be anywhere from 3 to 6 months, usually, depending on what part of the face and how quickly your body breaks it down. On average, I'm going to say that it's about that 4 or 5 month mark. We tend to see people coming back, because it's not that they immediately have all of their muscles moving again, but they start noticing some expression, and it's better to just knock it out right there and then to really maintain the overall result that you want.
We had a question about the difference in price between Botox and Xeomin. So Xeomin is a little bit less expensive than the Botox. I think for Dr. Charani, it's $20 per unit for Botox. And for Xeomin, don't really quote me on this, but I think it's like $15 a unit, so it is less expensive. But then we get an additional 20% less if our nurse injector does it, or as an introductory, Dr. Kashan would be doing it too at the 20% discount.
And we got asked again for teeth grinding, just in case you missed it. Yes, 100%. It works amazing for that. It works the same way that Botox works for it. It's really a phenomenal option for that. And I really think people get amazing results out of that.
Thank you.
Oh.
All right, so we're going to show you how we're going to show you Dr. Kashan doing a Xeomin treatment.
Okay.
We have, this is Xeomin.
Yes.
Hello, everyone. Now they can see me. Okay. So we have our fantastic nurse Joanna here that a lot of you have probably met if you've ever come into our office.
Hi, everyone.
And Joe has graciously decided to allow to be our model for this for So I'm going to show you guys exactly, I'm going to mark her in her forehead so you see exactly what we're targeting. So Joe, before we start, can they see us now? So you always want to have everyone do, so I want her to make an angry face at me. So you can see she's got these 11s here, okay, you can relax. So I'm going to mark those. So I know I'm going after those. And now raise for me as well. So you can see she has these lines here too, not too bad actually. Especially after a few kids, we expect even more. She seems to be very relaxed. We're happy. And what we're gonna do is, you can see she actually has nice contour to her eyebrows here. I'm gonna just lift this a little. So these injections will lift the eyebrow here, just very subtle. And this injection, you actually have a muscle that comes around the eye and reaches all the way out here. And what I'm going to do is, by paralyzing that, it prevents that muscle or the orbicularis from depressing the eyebrow, and it actually, that's where you get your lift. And this is what we were talking about. Doing that injection is what's going to give you that lift in conjunction with the Ultherapy treatment. Now, what I'm going to do is I'm going to have her lay down because I've already marked her, so she gets to relax now. And we absolutely use the tiniest needle we could ever use. Just if you want to give me a little alcohol.
So just a little pre-treatment here, just to clean the skin, just very little. We're going to start the injections now. And in general, we like to inject about, anywhere from 2.5 to 7.5 per injection to really make sure we get those muscles and paralyze them and still have that natural look, but make sure that they don't move it. Turn over there.
So it almost looks like little mosquito bites for a couple of minutes.
Yep.
And then it absorbs. So I like to tell the patients to move or make those frown lines, happy and angry, just to keep those muscles moving for the first hour after you get a Botox or a Xeomin injection. It helps for the product to get into that muscle a little bit.
And give me another angry face. And because she has a little bit of a stronger, that's perfect. I'm going to just give her a little bit more here. And I always save some for the end there just for that reason. And that's it. No bruising. You can go out today, no heavy lifting or exercise. We usually say until tomorrow. How was that, Joe?
Very nice and simple. Louisa, do you want to show the therapy machine?
Yeah, so we're going to show you the Ultherapy. So we're looking at an image here of the orbital rim. So that's the lower eye, okay? So what you'll see here is this white flashing, the lightest light that you see, that is the bone. And you can tell where it's targeting. So we want to avoid the bone. So we can see how deep we're going. So we have 3 transducers that go in at different depths. So the 1.5 is really where you want to target up here, and you want to target at the 3.0 mark. But you don't want to go any deeper because you're going to hit that bone. So that's what we're saying. We try to customize the treatment for the person. We scan. Can you come closer to here? We scan we're scanning the bone, and we're looking to see how deep we want to go. So we put different transducers in there to target this area without hitting that bone. Okay.
Okay, so I guess.
So does anybody have any questions?
Yeah.
You could type it in.
Do you use a topical?
No, you don't. We don't use a topical anesthetic. Generally, the treatment focuses under the skin, so you're not going to feel it on the surface of the skin. So I feel that using a topical numbing, it's useless really. So that's why we give you a Percocet and a Valium for the treatment to make you more comfortable.
What about injectables?
The injectables, we definitely do a topical numbing cream, absolutely. Botox can help you. Does Ultherapy ever dissolve fats? So we've had a few questions about this in the past. So heat does dissolve fats, depending on how deep we're going. We minimize the amount of lines that we put into an area. For somebody who is thinner, for somebody who has a little bit more of a heaviness, we tend to put a few more lines in there to actually generate a little bit more heat. So it actually helps to tighten a little bit better. It doesn't dissolve a lot of it. It may do it a tiny bit, but it's really not made for that. but generally for somebody who's thinner, they're gonna need less line, so it wouldn't do that at all. Okay, that's it.
Okay, thank you so much for joining us. For those who want to participate in our raffle, can you please send us your full name and we'll pick you randomly right now.
Do you want to talk about the specials?
Yes, of course, and while you do it, we want to mention that right now we have a special going on. It's a brow lift. It's 30% less than usual. It's 1,100 for a brow lift with Xeomin and Ultherapy. Okay.
Thank you guys so much for joining. We appreciate it.
What is so quick?
Oh, sorry. Well, I'll be stepping out.
So we'll give you several minutes to submit all your names. We're going to assign a number to every name that was submitted, and then we'll use a random number generator to pick a winner, and we'll show it to you. Okay.
I think we should just write it down.
Okay. Can you maybe turn off the camera? Lourdes. Sandra. Diane. Graham. Jessica. Wait.
Oh, sure, I sent it.
Yep. Okay, go down. Rice.
Anyone else that would like to participate? Okay, you don't work.
Yep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So far, 12 people. Anyone else? Guess that's it.
How can I submit a name?
So yes, now we are gonna assign a number to everybody. Hi. Excuse me, go ahead.
How can I submit my name?
Can you just type it in the chat? There is a chat form. Type it in.
I'm on a phone. I can't.
Or just give us.
Okay, what's your name?
What's your name?
Ellen Austin.
Okay.
All right, we put you down.
Yep.
Oh, Anna helps.
Okay. Okay. So right now we have 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 participants. And now I'm gonna turn on the camera. 6, 7, 8, 9, 10, 11, 12, 13, 14. And we're using a random number generator. We'll show you from 1 to 13. I cannot show. No, much glare. Okay, I guess you'll have to believe us. Number 2.
So who's number 2 then?
That's
Carvalho. Carvalho.
Lourdes Carvalho.
Oh,
Congratulations.
Lourdes. Hi, Lourdes.
Congratulations. Please contact our office to get your prize.
I was speaking to you yesterday, Lourdes.
Thank you so much all for joining. Have a wonderful day. Bye.